This segment is on the cranial nerves. Cranial nerves emerge from the brain at specific locations and pass through various foramina in the skull to reach the peripheral structures they supply. Like spinal nerves, cranial nerves occur in pairs. There are 12 pairs of cranial nerves. The nerves are identified by name and are numbered with Roman numerals from cranial nerve 1 to cranial nerve 12. The numbers are designated according to the locations at which these nerves contact the brain, with cranial nerve 1 being the most anterior and cranial nerve 12 being the most posterior. Some cranial nerves are entirely sensory nerves, which bring sensory information to the brain. Some are entirely motor nerves, which issue motor commands to muscles, organs, and glands, but most are mixed with both sensory and motor fibers. Cranial nerve 1 is the olfactory nerve. The olfactory nerve is composed of sensory fibers for the sense of smell. It is located in the roof of the nasal cavity. The nerve passes through the cribriform plate of the ethmoid bone and enters an enlarged olfactory bulb, which then extends into the cerebrum as the olfactory tract. Cranial nerve 1 is the only cranial or spinal nerve that is directly routed to the cerebrum without having to pass through the thalamus first. Cranial nerve 2 is the optic nerve. The optic nerve is composed of sensory fibers only that carry visual information. This nerve originates in the retina or the neural part of the eye. The two optic nerves meet at the optic chiasm just inferior to the hypothalamus. It is at this point that some of the sensory fibers cross to the nerve on the opposite side of the brain. This optic nerve enters the thalamus, which then relays the visual signal to the occipital lobe. Cranial nerve 3 is the oculomotor nerve. The oculomotor nerve carries motor fibers only that control 4 extraocular eye muscles, the superior medial and inferior rectus muscles and the inferior oblique muscles. Some of the autonomic fibers of this cranial nerve also control the intrinsic muscles of the iris and the ciliary body, which control the size of the pupil and the shape of the lens. Cranial nerve 4 is the trochlear nerve. The trochlear nerve carries motor fibers only that control the superior oblique muscle of the eye. The superior oblique muscle passes through a trochlea or pulley, hence the name of the nerve. Cranial nerve 6 is the abducens nerve. The abducens nerve carries motor fibers only that control the lateral rectus muscle of the eye. When this muscle contracts, the eyeball is abducted, hence the name. Cranial nerve 5 is the trigeminal nerve. The trigeminal nerve is the largest of the cranial nerves and carries both sensory and motor fibers. It is located on the lateral pons near the medulla oblongata. It services much of the face. It has 3 branches, the ophthalmic, maxillary, and mandibular branches. The ophthalmic branch monitors sensations from the forehead, eye orbit, and nose. The maxillary branch monitors sensations from the roof of the mouth, including half of the maxillary teeth. The mandibular branch also monitors sensation from the lower lip, gum, muscles of the tongue, and mandibular teeth. The mandibular branch also carries the motor portion of the nerve to the muscles of mastication, which is chewing. Cranial nerve 7 is the facial nerve. The facial nerve is a mixed nerve with both sensory and motor fibers. The sensory fibers monitor the sensation of taste for the anterior 2/3 of the tongue. The motor fibers of the facial nerve control the muscle of facial expression as well as the activity of the salivary glands, lacrimal glands, which are the tear glands, and the nasal mucus glands. Cranial nerve 8 is the vestibulocochlear nerve. It carries only sensory fibers of the inner ear. The vestibulocochlear nerve has 2 branches. The vestibular branch gathers information regarding the sense of balance from the vestibule and semicircular canals of the inner ear. The sense of balance is a special sense, just as hearing is. The cochlear branch conducts auditory sensations from the cochlea, which is the organ of hearing in the inner ear. Cranial nerve 9 is the glossopharyngeal nerve. The glossopharyngeal nerve is a mixed nerve of the tongue and throat. It monitors the sense of taste from the posterior 1/3 of the tongue. Remember, the facial nerve monitors the sense of taste from the anterior 2/3 of the tongue. It also monitors sensations from the palate and the pharynx. The motor fibers of the glossopharyngeal nerve controls the pharyngeal muscles involved in swallowing and in the activity of the salivary glands. Cranial nerve 10 is the vagus nerve. The vagus nerve is a complex nerve on the medulla oblongata that has both sensory and motor fibers and hence both sensory and motor functions. Vagus means wandering, and the vagus nerve branches and radiates extensively. It is the only cranial nerve that descends into the thoracic and abdominal cavities. Each vagus nerve monitors sensations about the external acoustic meatus, the diaphragm, and the pharyngeal taste receptors. The motor components of the vagus nerve affects the heart and controls smooth muscles and glands within the areas monitored by its sensory fibers, including the stomach, intestines, and gallbladder. Difficulty in swallowing is one of the most common signs of damage to either cranial nerve 9 or 10 because damage to either one prevents the coordination of the swallowing reflex. Cranial nerve 11 is the accessory nerve. The accessory nerve is a motor nerve controlling the skeletal muscles involved in swallowing, as well as controls the sternocleidomastoid and trapezius muscles of the neck. It is the only cranial nerve with fibers originating from both the medulla oblongata and the spinal cord. Cranial nerve 12 is the hypoglossal nerve. The hypoglossal nerve has motor fibers only. The hypoglossal nerve controls the tongue movements for speech and swallowing. Several mnemonics for cranial nerves have been created. The first letter of each word in the mnemonic corresponds to the first letter of the name of the cranial nerve. For instance, O, to touch and feel very green vegetables, heaven, stands for olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, vestibulocochlear, glossopharyngeal, vagus, accessory, hypoglossal. A mnemonic that clarifies whether the cranial nerve contains sensory fibers, motor fibers, or both types of fibers can also be used to help memorize the functions of the cranial nerves. For example, some say marry money, but my brother says bad business marry money, shows what each of the cranial nerves carries. Olfactory carries sensory fibers. Optic carries sensory fibers. Oculomotor carries motor fibers. Trochlear carries motor fibers, etc.